Hey everyone, it's Dr. Jacobs again, and we're here to talk today about our second module here in the SMI class, which is talking about the history of serious mental illness through an anti-racism lens. So first, I want to say quite transparently that I am talking to you as a white cisgender person. So I am talking about this lecture through a lens of incredible privilege, and I am aware of that. And I know that there is an incredible level of privilege I have teaching this class as someone who does not experience serious mental illness. But it would be a disservice to the community, to social work, to mental health as a whole, if we did not look at serious mental illness through an anti-racism lens, because there have been so many communities that have really experienced incredible racism. And that's why we're going to do this module right now. And I'm glad that we are going to be able to do it together. And while there's a lot of reading in this lecture and some very long videos, I truly hope that you all take the time to read them all and watch them, because they are all really, really helpful when we're talking about being anti-racist social workers. So I want to start just by talking a little bit about anti-racism itself. No one is born racist or anti-racist. These result from the choices that we make. Being anti-racist results from conscious decisions to make frequent, consistent, equitable choices daily. These choices require ongoing self-awareness and self-reflection as we move through life. In the absence of making anti-racist choices, we unconsciously uphold aspects of white supremacy and white dominant culture and unequal institutions and societies. Being racist or anti-racist is not about who you are, it's truly about what you do. When we choose to be anti-racist, we become actively conscious about race and racism, and we take actions to end racial inequalities in our daily lives. Being anti-racist is believing that racism is everyone's problem and we all have a role to play in stopping it. Being anti-racist is different for white people than it is for people of color, and this is what I really wanted to say from the very beginning. For white people like myself, being anti-racist evolves with our racial identity development. I'm going to use we, as I am a white person. We must acknowledge and understand our privilege and work to change internalized racism and interrupt it when we see it. And that's really important to say. So all racial groups struggle under white supremacy. People of color groups are not always united in solidarity, but that is not, the focus of this lecture in particular. And for everyone, this is an ongoing practice and process. And I really want to say that one more time. This is an ongoing practice and process. And one step in doing this is talking about how racism has permeated individuals that have serious mental illness for a long time. So I'm glad that we're going to talk about that in this lecture and in this module. So numerous studies over decades have shown that Black Americans are diagnosed at higher rates with schizophrenia than white Americans. In a 2018 analysis of data from over 52 different studies, researchers found that Black Americans are 2.4 times more likely to be diagnosed with schizophrenia. Other studies have shown that Black Americans are diagnosed at 3 to 4 times the rate of white people with serious mental illness. So I hope you're sitting here and you're saying why, or this is crazy, or this is horrific, or this is terrible, this is atrocious. There are many reasons, but two reasons that I found multiple times documented in new research data over the last few years, because this is really starting to be studied in the last 10 years, are there is an assessment bias during the diagnostic process. and the fact that individuals that are Black experience more environmental risk factors for the development of schizophrenia. The other information is that the answer is not entirely clear because it is incredibly complex. That is what is been said by Dr. Herlins, who is a clinical director of the Lieber Clinic, which is part of the Columbia Psychiatry Network. So there's lots of different things out there. What's also out there is that even though this is an area that's being researched, more research is needed. There are studies that are happening, but more studies are needed so we can continue to understand why this is happening. So when discussing the relationship between race and schizophrenia, I mentioned prior that there's possibly some information about environmental factors. Scientists are saying that schizophrenia is only partially genetically determined. It's very likely that environmental factors can make someone vulnerable. Marginalization and trauma are known risk factors for developing serious mental illness like schizophrenia. There was a May 2021 study that was developed in the American Journal of Psychiatry that explained that Black Americans are marginalized and experience significant trauma due to systemic and interpersonal racism, including police brutality, which could contribute to the higher observed rates of schizophrenia. But again, I'm going to keep saying this, the role of racism in schizophrenia has not been studied enough. So it is really important if you are a clinician that's working in serious illness to eliminate all other causes or presentations before diagnosing schizophrenia. That should be the last diagnosis. Some symptoms of schizophrenia, like psychosis, can overlap other diagnoses like bipolar disorder. What's happened is that when individuals show up for evaluation, oftentimes for Black Americans, the psychotic symptomology is overemphasized. And there's less emphasis on mood disorders, which skews the diagnosis toward result in psychosis, which could be substance use, which could be trauma, it could be mood disorders, it could be depression. You have to eliminate all those things first. If a clinician is undervaluing those things and not addressing the presence of mood symptoms, it can be really easy to diagnose someone with schizophrenia. There was a Rutgers study that said that Black Americans with severe depression are more likely to be misdiagnosed as having schizophrenia. The author suggested that racial bias, whether it was conscious or subconscious, was a factor in the diagnosing of schizophrenia. So the issue with putting together this lecture was there wasn't a lot of information on what do we do next. And in social work, especially in teaching, we always want to be able to teach that part, like where do we go now? So these were the two things that I was able to find: a more deliberate diagnostic process using tools like the structured clinical interview. That isn't talked about as much in social work. That's talked about a lot more in psychiatry, but that is one piece. And then hopefully this isn't as surprising, but when possible, having a practitioner from the same racial group as the patient, which would reduce bias and lead to a more accurate diagnosis. So that is our lecture for Module 2. Thank you very much and have a good day.